So I think it's nice to have multiple options. And I don't think you necessarily need to offer every option, but to be able to have maybe one or two option in each bucket to be able to offer patients.
This is the Medical Sales Accelerator Podcast, featuring tips from top performers, delivered like a conversation over cocktails. Listen in to glean wisdom from the best of the best and accelerate your results for years to come. Now, here are your hosts, Zed Williamson and Clark Wiederhold.
Welcome to the Medical Sales Accelerator Podcast. I'm Zed Williamson.
And I'm Clark Wiederhold.
This podcast exists to put scale to the value you get from those great one-to-one conversations at conferences and sales meetings.
We all spend a lot of time, money, and energy preparing and executing at conferences. Does it really make an impact? Let's hear from a physician's perspective.
That's why we're speaking with our guest today, Dr. Garrett Pohlman, urologist and host of the Prostate Health Podcast. Dr. Pohlman, thank you so much for joining us today.
Thank you for having me on the show.
Enough surgeons use your technology, but you need them to offer it to more patients. Or not enough surgeons use your technology. In either case, you might still grow at a satisfactory rate, but are you one to leave it to chance? Imagine knowing the causal effect of surgeon adopting your technology and then purposefully driving behavior change in new users. How? Trackable Med. You see, most marketing and advertising companies ignore heuristics and biases, leading to wasted money, failed marketing efforts, and lost sales opportunities. Trackable Med uses proprietary, heuristic-based neuromarketing to create turnkey co-marketing, direct-to-MD messaging, direct-to-patient messaging, sales collateral. Companies are deploying these tactics, creating massive leverage for their team in the market. But you may feel like you should just keep doing things the way you always have. Or you may realize it's time to evolve. Learn more about heuristic-based neuromarketing and see medical device case studies. Visit trackablemed.com. Trackable Med. Leave nothing to chance.
So it was great to meet you in person. We were both at AUA in Chicago a couple of weeks ago. And I'm excited to hear from your perspective, urologist kind of walking the halls, the experience of booths, the impact of booths, and things that they should do better, they shouldn't do, they should do more of. So let's just start there. Is there anything that really wowed you at AUA that grabbed your attention?
Well, I think it's always amazing walking through the exhibit hall, just the booths themselves. I mean, just the engineering, the things that they think of to catch your eye, to kind of draw you in. I think there was a booth that had, they were creating sand castles or sand sculptures. I mean, there's so many things there that catch your eye. And I think there was a lot of new technology that I thought from an exhibitor perspective, but also helping connect with physicians. That was pretty cool. And, for example, taking a picture of the badge and having a little scanner there that will pull up your information. And I'm already getting, emails, back from some of these companies reconnecting from the conference. And I think that the AUA does a good job of trying to help out the companies, the exhibitors to, really improve that experience, connecting with the physicians to, really help partner with them.
I'd like to set the stage for the audience a bit. Dr. Pohlman, you are Booth's favorite type of physician because you're actually interested and excited in technology. There is the case where sometimes people go through the technology hall with hands covering both sides of their eyes and, please don't look at me, please don't look at me. And then I think even you mentioned some people don't even go into the technology hall.
Yeah, I definitely can see both perspectives there. And I definitely was excited to get around to see all the new technology and learn about it and see where I can implement some of those technologies in my practice. But I agree. I think that there are urologists, they don't want to be sold to. They kind of have a set way that they like to do, how they like to treat BPH or prostate cancer, and they're comfortable. I think they maybe don't want to get out of their comfort zone with bringing these new technologies into their practice and likely avoid eye contact walking through the exhibit hall or probably just stay over in the on the other end where, just listening to the talks and don't even make their way over into the exhibit hall. And there's definitely two personas there for sure.
Is there anything that you think that medical device companies, teams could do differently or better that would help drive more value for the actual technology hall for those physicians that are maybe not dipping their toe in as much?
I think it's definitely a mindset in terms of not trying to sell to the physician, not trying to, kind of be pushy. I think that's definitely a turnoff for me is when I feel like a tech company is really just trying to push that on me. I think that it's coming from it with, we have this technology, we think it could help, and this is where it could potentially fit into your practice. I think, especially private practice, urologists are definitely mindful of cost and reimbursement, and to be prepared to have those talks. What is this going to cost to bring into the clinic setting? What does reimbursement look like? What's the cost of the patient? And I think those are discussions that, what's the CPT code for this technology? I think those are the discussions that you need to be ready to have, and to be there to help out, to be a partner with them, but not to be overbearing as well, and be respectful as well.
I think that's important. I had the pleasure of walking around AUA with you with the recording device. So we got some audio from that. And one of the booths that we first came across was Promaxo. And I thought they did a good job of drawing people in. And I didn't feel like they had that pushy sales experience at all. Am I off base from your perspective? I know I have a different one, but how did it feel to you?
No, it definitely felt very welcoming. And I think that has a lot to do with the team, the personnel, the individuals they recruited to that company. I think it says a lot about that in terms of I felt that same way. I just felt very welcomed. It felt like you're kind of part of the team. You just felt like you wanted to learn what is this technology, and they were there to help understand it for sure.
So at the Promaxo booth, I chat briefly with Cliff Bauer, VP of Sales, and Josh Miller, Area Director for the Central U.S. I asked Cliff, what is he hearing from booth visitors?
We get questions as to how does this fit within their practice? How does it fit within their workflow? When they have a patient that presents, what is the ideal patient?
And Josh, in the field, getting feedback live from physicians who have interest, don't have interest, what kind of things are you seeing with Promaxo?
To be honest, they're pretty amazed with just the ability to have a portable MRI in the office setting or in the ASC setting. Up until now, obviously the majority of MRI has been based in the hospital setting, and just the ability to bring that in-house, make it more efficient and better for the patient, obviously, that sparks their attention first and foremost. So gives us ability to drive into, what they're currently doing for prostate biopsy and, dive in from there.
And from an investment standpoint, and I know you don't have hard numbers, but you're at AUA, it's a pretty significant booth. Do you feel that you're getting a good value out of this experience?
Yeah, we've had a lot of traffic this year. A lot of our customers are aware of the concept, have heard about the platform, and they're coming over just to get reinforced and see the equipment firsthand.
And Josh, when you think about the connection to physicians out in the field, are people pretty open to chatting about this idea? Do you have to do a lot of work to get in? How does that feel?
No, I mean, to be honest, they're pretty amazed that this is an ability to have this technology in the office setting. So they want to hear more about it, and just the ability to take care of patients better, quicker, safer, and it's obviously financially good as well. It kind of hits all three legs of the stool, if you will. So they definitely want to learn more as soon as we kind of break the ground, if you will.
Next, we were drawn to the Barrigel booth, where I chatted with previous podcast guest, Michael Wadler, Area Business Director. I also asked him what he hears at the booth, and we talk about challenges from visitors.
First of all, where'd you get this awesome booth, which I had nothing to do with? But the other thing is, tell me about Barrigel. We're hearing more about it now that we have FDA clearance and word's getting out there. So physicians just want to understand the differences with our technology versus what's currently on the market.
And when you do get to that discussion point, what are some of the most common pushback that you get from physicians who maybe it's a counterfeit pushback because they're not jumping in, but what do you hear from them?
I like what we currently have. We like that we can see the current product because it's iodinated. Can we see your products on CT? We've had success with what we currently use, so why would we make a switch? Those are probably the most common ones.
When you hear feedback like that, what does your team typically do?
Typically tell me a little bit more about your current experience with the product that you're using, and just dive a little bit deeper into the question itself of, so we can understand what direction we need to take the conversation. So if it's around an iodinated product, yeah, ours is not, but let me walk you through how you can see ours. Or, what's been your experience? What have your patients' experience been? How are you currently working with your radiation oncologist, and what has their feedback been regarding the product? Because there are some differences with ours that your radiation oncologist you work with may appreciate about ours versus what you're currently using.
Those are really a lot of great nuggets on how to deal with pushback. Speaking of the idea of being drawn in or welcoming, I also got the same sense from the Barrigel booth. Your thoughts on their setup?
Completely agree with that as well. I mean, and I don't know if it was just the way the booth was designed. I think it was kind of in a circle. They had like a center pillar, and it had a little ledge around it where you could just come and put your phone, or you could just, it was almost like you're at the lounge, just chatting at a bar with the representatives from their company. It felt very casual and welcoming. And then you got talking with some of the members of their company, and it did feel that way as well. It kind of had that same feel that the Promaxa booth did.
Then we passed a smaller booth that caught the interest of Dr. Pohlman. Walking the halls of AUA 2023 with Dr. Pohlman, and came across this really interesting technology, Valencia Technologies, and the eCoin. And we were lucky enough to talk with Jerry Schlafman, Chief Commercial Officer. Tell our audience, what is the eCoin?
Yeah, in a nutshell, it's the world's first fully implantable, self-sustained tibial nerve stimulator to treat overactive bladder and urinary urge incontinence.
It's fascinating. And I see you actually have one in your hand.
Yeah.
And this is about the size of a nickel, I would say.
That's exactly how we describe it, about the size of a nickel, implanted under local anesthetic in a pretty non-invasive procedure. Patients wake the whole time, and then at the end of the implant, they put their shoes and socks on, go get in the car and drive home, and then it self-stimulates. So the patient gets neuromodulation treatments twice a week for the next 3 to 5 years without a remote control, without a recharging, totally hands-off, kind of set it and forget it for those that remember those commercials.
What has the feedback been? What is the disbelief? What is the surprise? What are you hearing?
Yeah, I don't know that there's disbelief, because it's based on the premise of percutaneous tibial nerve stimulation, which is accepted science. I think they want to know how to get involved and when, and they want to know what the early results have been. And the response from both the physicians and the patients has been fantastic, everything we expected.
And Dr. Pohlman, your thoughts? Now you're holding it in your hand.
I'm always looking for technology that I can bring in the office setting. I think it's more efficient for the urologist. And I mean, we're looking at a urologist shortage here. And so, we need to be more efficient. But also from a cost perspective, to be able to bring technologies into the office, it's less cost to the patient as well. So very excited to continue to learn more about the technology, and look forward to hopefully, bringing it into our practice as well.
So the founder of this company, a gentleman named Jeff Greiner, had a long history in neuromodulation in spinal cord stimulation and cochlear implants. So he knew that going to the OR was a barrier. He knew that lead wires and patient controls were a barrier. So when he envisioned this, it was envisioned as an office-based procedure. All but one physician in the clinical trial did them in their office, and we've actually had our first commercial cases done in the office. We're working towards a Category 1 code for an office placement, but I'm glad that's where you think it should be, because that's where it was designed to go.
You host the prostate health podcast, and a lot of prostate health has to do with BPH. What was your experience at AUA with companies that specifically address BPH?
It's definitely exciting times for men and the treatment options out there for BPH. There's really been an explosion of new treatments and a lot of new treatments coming down the pipeline, minimally invasive therapies that can be done in the office setting. So I think it was exciting for me to continue to learn about even some of the new technologies that are not even available, that are still kind of in the clinical phases. And there were booths there that had products that weren't even are not even out there yet for use, but I think they're excited about getting the word out already about their technology. So I was definitely excited. I think just even in the next 2 to 3 years, we're going to see probably 4 or 5 new minimally invasive options available.
We shift over to the world of BPH and we passed the Procept Biorobotics booth and chatted with Sham Shablak, Chief Commercial Officer. I asked him what he's hearing at the booth from visitors.
We focus predominantly in the world of BPH surgery. And so we clearly are an early stage company that's had a lot of success. So the folks that come by are really looking to understand how the data has matured, how we've been able to commercialize in our training processes. And so we share a lot about how we onboard surgeons, and so they have a successful outcome from the first procedure. The technology is an automated surgical robot. And so things that we've done in BPH surgery are changing the way surgeons and patients can think about getting treatment. You don't need to go to a specialist who's done 1,000 BPH surgeries to have an outstanding outcome. You can go to a surgeon who knows the anatomy, knows how to use basic urologic procedures, and can have a great outcome that's durable and it's been proven now to be effective from procedure one.
And you and I were chatting before we hit record. And speaking of data, the importance of long-term outcome. Can you kind of walk us through that?
Yeah, this company has been around for over 15 years, though we've really only commercialized for a couple years. The first 10 years of Procept were highly focused, and the investment was made obviously in research and development, but heavily made in clinical data and clinical research. The foundation of the company is based on 2 FDA studies. One of them was a randomized study versus TURP, which is the gold standard, the only BPH company to ever do that. That data has now matured to 5 years. And then we did a second randomized study for large prostates, 80 to 150 grams. And that data also has matured to 5 years. And we've now shown that regardless of the size, from 30 to 150, you can get consistent results, which is something that has been very, very challenging for many surgeons to be able to accomplish in their practice.
Next booth was Focalix, and that booth caught your attention, right, Dr. Pohlman?
You know, it really did. As a urologist in a private practice setting, trying to be efficient and help out as many patients as I can. I currently treat prostate cancer, including candidates including patients who are candidates for targeted focal therapy. Currently doing that in the hospital setting, and really interesting to get to talk with Dr. Bianco, who is currently doing targeted focal therapy with cryotherapy in the office setting, and with good outcomes, with reported minimal discomfort for the patient. And so, that was very exciting to me to have that conversation with Dr. Bianco.
Yeah, and here is Dr. Fernando Bianco, the founder.
So I started Focalix about 6 years ago, and the backbone of Focalix is a fusion device that blends what's called, the ultrasound with the MRI images, and really aims to give urologists precision into how to guide either for obtaining tissue samples or for treatment. And currently we do transperineal treatments in the office, either cryoablation or laser, but this will be also amenable to many other forms of energies that are coming down the road.
I guess my question to you would be, you had mentioned cryotherapy as one of the options, and that is a technology that I've been familiar with in targeting the whole gland, but also just targeted focal therapy, typically in the hospital setting under anesthesia. And would you say the majority of the patients you're treating and your providers are treating focally, is it with cryotherapy or other technologies as well?
So Garrett, that's a great question. The only one that has an FDA label to treat prostate cancer is cryoablation, because it's being done since the 1960s, right? So grandfather in. Most of the other energies are working into this, right? So we recently completed accrual on a phase 1 trial evaluating transperineal laser ablation for prostate cancer. We just started doing the 1-year mandatory biopsy on this patient. So next year, I'll be happy to share those results with you guys, because accrued took place throughout the year. So it's all accrued. And, it is promising because it shortens the period of the treatment, right? The other point that you brought up, which is the cost point, is very interesting for the industry, because when you remove the hospital from this setting, the cost of doing this is substantially lower than those associated with surgery or radiation. Okay. So, and then You also have another cost-saving measure that has to do with surveillance, where you have to biopsy patients every 18 months or 2 years. And, they keep going at that and through the rectum and all the nasty stuff that can happen. Because we do this through the perineum, data that we're presenting here, the AUA this year, shows that when you have an MRI a year later, where the untreated prostate, you apply the PIRAT system, and they have a PIRATS 1, 2. And in the treated area, there's no enhancement. So it's showing like the tissue is kind of gone, right? Or it's just scar. Then you don't really need to do a biopsy, because the biopsy positivity associated with those findings are less than 5%. And then you can focus your biopsies on those who have PIRATS 3 to 5, or they have enhancement, or they have a rise in PSA. So you're concerned you may have a non-visible lesion. But that cuts down also the significant number of biopsies. And when that biopsy is negative, now you have a reassured patient that you follow over time, like you would any active surveillance patient, with the difference that they have the peace of mind that the tumor has been taken care of. And over time, if their PSA starts rising or so suspicious, then it's like repeating the cycle, but they stay on, to say, the spectrum. So one of the most notable observations that we have made now in 10 years that this program has running, and now with about 100 patients that have completed at least 8 years of follow-up, is that the rates of conversion or progression to either surgery or radiation are under 10%. And that compares very favorable to what happens with surveillance and the cost associated with surveillance over time.
Do you feel at this type of conference that you have enough time to uncover things that you are unaware of? Sometimes these conferences, they have these gigantic booths that they must have invested hundreds of thousands of dollars into. They're building them with cranes and teams of people. And then there's, the booth like our booth, where, it's a table and a chair and a little flappy, lit up sign type thing that's in the back corner, next to a tumbleweed blowing by. Do you get a sense? Do you get time to be able to pass booths like that?
I did. And I don't think, my perspective, the big fancy booths made a real big difference for me, in terms of whether or not I was going to stop by. I stopped by plenty of booths that was just a table, and had a banner. And so it was more the technology, that intrigued me, not the setup. I mean, the setup can be nice. And, some of the bigger booths, they had different spaces, especially if they're have a big crowd that they can accommodate all of the physicians at the same time, where there was a couple of booths that had just the table, and there was quite a, 3 or 4 urologists around that booth. And I couldn't really get into talk to them until those urologists left. So, I mean, there's pros and cons, obviously, from a cost perspective, but in my mind, if I was interested in the technology, I was willing to go back to the table to talk to the representatives from that company to learn more about it.
I'm glad to hear your comment about there not being a big difference. I'm going to jump on a little bit of a biased, opinionated soapbox for a minute, because there is tremendous investment that goes into some of these booths. For instance, earlier in the show, you mentioned building sandcastles. That probably cost them a fortune to set that up. In the same time, those companies will choose not to do direct-to-patient advertising, or they won't do co-marketing programs that helps educate patients on the existence of their technology. And it's always been interesting to me, because you have companies that push back on understanding what the return on investment is around things like direct-to-patient advertising, but then they go and spend, $1 million at the booth. And if you ask what is your return on investment on that, it's more of a, we got to be there. Okay, well, do you have to be there with sandcastles? So not sure if you have a thought on my opinion. I know I'm biased, but.
I mean, I totally agree. I mean, while that's neat and cool to see some of that, to be honest, the booth that had the sandcastles, I never stopped by to learn about the product. I just kind of, that's kind of interesting.
I was going to ask you if you could name the company.
I think they had maybe an overactive bladder medication, but it didn't stick in my head. Yeah. I just remember the sand, the guys there building sandcastles and structures and sculptures out of sand. But
yeah,
I think it was fake too. I think it was all built there, and they were literally walking around moving sand from one place to the other. But that's okay.
Not surprising.
Dr. Pohlman, Zed mentioned earlier, you really engage in technology compared to some others in your specialty or just surgeons in general much earlier. I would call you on the adoption curve likely an innovator or an early adopter, somewhere in that range. Not everybody is that way, and that's okay. It's a reality when you're building markets out that there are customers that have different adoption curves. So your peers that aren't as excited to be working with technology early on as you are, what do you feel like industry could do to help wrap their arms around those folks so they feel less threatened? They're coming and getting educated on what's coming in the future earlier at these shows.
I think, and you kind of touched on it before, I think that's where some of the the direct to consumer marketing can really come into play, because with some of those campaigns that I participated in for BPH, I have patients coming in asking about that, those types of options. And so you have a urologist that is not offering that, and they actually have patients, coming, or primary care providers referring them over to discuss these options. I think that can be helpful, and maybe they can maybe feel like, oh, I'm kind of behind here. I'm not doing this technology. Patients are actually asking about it. A lot of urologists like to see the results, or they like to have it be established for several years before they kind of come on to the scene with offering newer technologies to kind of see what their peers think about it. And so, I think that's where key opinion leaders can come into play, and positioning those key opinion leaders within the different territories in terms of being a resource to their peers. And anytime I try a new technology, that's the first thing I'm going to be asking, okay, who's doing it? Can I talk to them? Or, or if I already know them, I'm going to be reaching out, I'm going to be texting them, hey, what do you think about this new product? What are your thoughts? What's your experience? And so that's another strategy in terms of positioning those key opinion leaders in those territories where they have those contacts to be kind of a leader, a champion per se, for that new technology.
Yeah. I'm so happy that you walked through multiple phases of that answer, because there's a lot of depth there. And I'd like to point out coming to the latter part of that, the explanation. If this is your first time at a startup or an earlier technology within one of the strategics, you're really building a marketplace. It is critical for you to make sure that your earlier customers are identifying those prospect or those potential patients properly. So because you need those outcomes to be successful, of course, you always want good outcomes. That goes without a doubt. And I've never run into anybody in this industry that was just here for the sake of being here and didn't want good outcomes, because that could be your family member. That goes without saying. But it's really critical when you don't have the number of outcomes or patient stories to reflect on, because of the situation you just talked about. You're calling some of those other folks that are a little ahead of you and saying, hey, what were the outcomes? What did it look like? So there's the sales aspect of it. And then there's knowing exactly, being tuned up so that you can provide as much assistance clinically to the clinical team as possible to help drive those outcomes, the success, and the understanding of what success looks like with that patient population. It's really, really key. And there's nuance there on the tech side from a marketing and a clinical perspective, but it's really important.
So you had mentioned the impact of direct-to-consumer marketing. And I'm curious if what you witnessed when patients came in asking specifically about a therapy, were you seeing patients coming in for a disease state that were coming in a little bit earlier than maybe you would have seen them normally?
Absolutely. And I think that's where the education comes into play too. For example, with BPH, I think there's some definite value in, from a bladder health standpoint, in not kicking the can down the road, so to speak, with medications that really don't fix the problem. So with these campaigns that help educate men about the options, that there are options other than medications, but also maybe some of the risks of ongoing bladder outlet obstruction. And so, I think that really gets their attention. Oh, first of all, there is another option. I don't have to keep taking these medications. And there's options that are minimally invasive with minimal to no, sexual side effects. And I can get off this medication and actually have better improvement than what I was getting on the medication. And yeah, I'm going to go find who does this. I'm going to go online and search to find a physician that does it, or at least talk to the specialist in my community to see what he thinks. And I'm going to go in. And so, yeah, I think we're seeing more of those patients that otherwise we wouldn't have seen them until maybe it was too late.
It's something we witness all the time. And it's because patients are actually built to think that they're supposed to feel this way. It's, probably something that you hear all the time of patients saying, I wish I'd come in sooner. I had no idea. And, the last booth you and I visited, they do an extraordinary job of patient education. And that's when we stop by the Axonics booth and speak with John Woke, Chief Marketing and Strategy Officer, where he tells us what he's hearing at the booth from visitors. And then Dr. Pohlman, you had some questions for him about their sacral neuromodulation product and how it compares in the marketplace.
I think first and foremost, we're hearing that, people are really excited to be out and back at conferences. It's been quite a process, coming out of COVID. And so I think everyone's excited to be here, see old friends, catch up, and also see what's new from a technology perspective. So for Axonics specifically, we're getting a lot of great feedback on some of our recent innovations, both with our sacral neuromodulation platform, as well as with Bulkamid, our urethral bulking agent. And so I think people are really excited to see what industry is doing in terms of all this continued innovation, investment in these therapies, investment in supporting patients and supporting providers, and then also from our perspective, investment in direct-to-consumer marketing and marketing with practices.
First of all, thanks for joining us today. And so far, you brought up Bulkamid. That's actually a technology that I was excited to recently implement for my patients. Historically with the urethral bulking agents, you didn't have the effectiveness that we were looking for. And it's been so nice to have that as an option now. And our patients have been very happy with the success rate, but also we're not having to put in mesh, much less invasive, and get back to the routine activities. Now, looking from more the OAB or overactive bladder standpoint, your sacral neuromodulation system is something that I'm not currently utilizing, but what can you tell me about your technology and how can that benefit my practice and my patients?
So it's a great question. And we're really excited with where we are today with our sacral neuromodulation platform. We've had a lot of innovations over the past 12 months, including the introduction of our non-rechargeable system that can last for 10 to 20 years with the decent lead placement. And then just in the past few months, we had approval from the FDA for our 4th generation rechargeable system, which allows a patient to go now 6 to 10 months, maybe even up to a year, between recharging their device and still just recharging for an hour at that interval. So we're trying to essentially reduce the recharging interval for those patients to where it's almost like a non-rechargeable and they still get that small form factor, great MRI access. And so we're committed to continuing to push forward and innovate with our sacral neuromodulation platform while really keeping what defined us as we came onto the market in the United States in 2019, which is a really easy to use platform for patients. An easy to use patient remote control that they can hold easily out in front of them, operate with one hand, a smart programming algorithm that we use interoperative data to actually predict which program is going to work best for the patient, to really take the burden off the patient and off the practice. And so I think what providers like yourself have found as they've adopted Axonics and given us the opportunity to work with their practice is that it really is easy to work with us and it's easy to work with our products and it makes for a great experience for their patients and for their practice.
Earlier, when you guys were talking about direct to consumer and driving patients to a provider early in their continuum of care, that can have massive implications in thwarting off future issues. I'm curious, when you marry that with less invasive technologies, Dr. Pohlman, that I know you're highly interested in, and even potentially changing sites of service where you can offer that from, say, a hospital to maybe an ASC to maybe an office. Reducing an additional benefit could be technologies that help reduce recovery times and other things along that nature. How does that play into your decision-making and your treatment algorithms as these new technologies become available to you?
I think it's overall nice to have multiple tools in your tool belt, so to speak. Because I think there are some urologists that try to just kind of put every patient into one treatment box when based on their anatomy, I don't think every patient fits into one of those different categories. And so I think it's nice to have various options within each kind of bucket, so to speak. For example, for BPH, there's kind of a mist therapy or minimally invasive options. And then you kind of go into more maximally invasive, and there's kind of a spectrum in between. And so, and a lot of it depends on their anatomy. And so in each one of those buckets, there may be, several options, and that one that might feel a little bit better to you as a urologist than the other. And so I think it's nice to have multiple options. And I don't think you necessarily need to offer every option, but to be able to have maybe one or two option in each bucket to be able to offer patients. So I think that can help drive a urologist to maybe feel more comfortable to go into that space, especially more into a in-office type option where maybe before they were only doing procedures, TURPs, and things like that at the hospital. And so to have several options, maybe one may not feel like the right fit for them. And also in the end, having more and more urologists offering some of those different treatments, I think it can help patients in the long run as well.
One of the things you guys were all discussing, again, coming back to just that patient education piece that ceases to amaze me is really tapping into what we can define as the untapped addressable market. And that is this bolus of patients in a specific patient population that they think they know what the answer is. They believe they know what their option is going to be if they go get checked out, and they don't want it. So they just don't go. They've got this feeling that they believe they need to live this way as part of getting old or whatever the ailment might be. And so they've almost just decided they're not ready to take action until something disrupts that thought pattern and they realize that there could be a better option. And then they come see you. And all of a sudden now you're treating them earlier. It never ceases to amaze me how many patients just aren't seeking the option because they believe they know what the answer is. I'm curious, do you witness the same thing in your practice?
Well, I think a lot of men feel that this is just normal, a normal part of aging to experience some of those symptoms. And so that's where I think the education piece comes in, is that, yes, it's common. It's very common to start having these symptoms, but no, it's not normal. You do not have to feel this way. You do not have to have these symptoms. And so if we can continue to educate not only the men, loved ones, but also their primary care providers that are seeing these guys every day, that no, this isn't normal. And yes, there are options to improve the quality of life, and options that do not have some of the historic side effects like sexual dysfunction that some of the more traditional kind of gold standard treatments did have.
And think of how many patients are out there today on the other side in urology, the other side being non-BPH, but OAB. And they're literally being told by primary care and some urologists, well, you're just going to have to go get some diapers at Walgreens, as opposed to being open to looking at these technologies. Is that, maybe a sacral neuromodulation device would be right for you potentially, where before it was, well, you just got to deal with it.
It's kind of impressive to see that even within a practice, I've seen practices that have maybe one or two urologists that offer that treatment, and then the other urologists don't. That doesn't even get brought up in the conversation in the same practice that has the urologist that does offer that treatment. It's not even being brought up in the discussion that this is an option for them. And that's where, for overactive bladder, you have so many patients that never come back. They take the medications that the urologist gives them or their primary care provider gives them, doesn't work, or they don't tolerate the side effects, or it's too costly. And they just feel that, well, this is my life now. I'm just going to have to deal with it. And that's where it's important, from an education standpoint, actually have a roadmap that I give every patient with overactive bladder from the get-go, so they can visually see, okay, this is where we're at. We're currently working on behavioral changes. Medications are an option, but we've got these other options down below here that work differently. And maybe that's why you may not be getting the symptom relief from medications, is because it's working differently. It's working on the bladder muscle. It's not working on the nerves. And so we've got these other options for you that actually can help you if these initial options don't work. And so I think if you can educate them that, okay, we're going to try these initial therapies. And if they don't work, you're coming right back because we're going to still help you out. So from the get-go, if you can educate them that this is the roadmap and you're going to see them back versus if you just hand them a medication and say, okay, follow up in 6 months, they're probably not going to come back.
I love that. Only 36% of patients that get referred actually make it to a specialist. So imagine of those people that just get that medication and then they don't come back, what the actual number is of truly helping somebody. It's ridiculously low. And I believe medical device can own education. They can help patients almost more than anyone else. So I think this has been a really important episode. I appreciate you taking the time and spending it with us today. We will put the link to your podcast in the show notes of this podcast so people can check out the Prostate Health Podcast. And I really appreciate you also walking around AUA with me. I kind of felt like I was the roadie to a rock star, getting to walk next to the person that all the booths are interested in.
We should do it again in San Antonio.
Sounds good.
Next year.
Maybe this time you guys will wait for me.
There we go.
Trying to get there on a plane. Late to prom as usual.
And this is kind of a side note too. I don't know if you want to use this or not, but it's been fun doing the podcast and being able to educate so many people. And we've got listeners in 135 countries now.
Wow.
And just even my own patient population, people that I see that are listening to I've had episodes on technologies that I'm trying to get them into my practice, but I'm having so many patients that have listened to the episodes. They want, this new technology. And so there have been some situations where I will get them to who's doing that technology because I feel like I am on the forefront. I'm one of the first to market in most of these technologies in our region, but the patients are pretty smart. They're educated. They're better educated now, especially that's been the goal of the podcast. And there's better routes of, there's still a lot of bad information out there on the web, but a lot of men and their loved ones, they'll find the technology that they feel meets their personal needs and they'll travel. They'll go to where they can get that technology.
I'm a big fan of what you're doing. And even just your breakdown from the show post AUA with the technologies that you were engaging with you made it super digestible and clear with some of it being, it's pretty heady stuff. You made it really easy to understand what was going on very quickly. So it's good stuff.
Yep. The education,
appreciate the feedback.
So visit medicalsalesaccelerator.com. When you do so, you can sign up for an email to get information on upcoming episodes. You can download a resource that helps you communicate better with your customers, and you can suggest a guest or topic for upcoming episodes.
If you found value in today's episode, please do a few things for us. Leave us a review. We love those 5 stars. Drop some stars. Subscribe to the podcast. It helps other people find the podcast more easily, and we greatly appreciate it because it helps this message grow. And lastly, go to the square with the arrow out at the top. Send it to your friends, your family, your mama and your daddy. We greatly appreciate it. Dr. Pohlman, once again, it was a pleasure. Make it a great week, everybody.
Enough surgeons use your technology, but you need them to offer it to more patients. Or not enough surgeons use your technology. In either case, you might still grow at a satisfactory rate, but are you one to leave it to chance? Imagine knowing the causal effect of surgeon adopting your technology and then purposefully driving behavior change in new users. How? Trackable Med. You see, most marketing and advertising companies ignore heuristics and biases, leading to wasted money, failed marketing efforts, and lost sales opportunities. Trackable Med uses proprietary, heuristic-based neuromarketing to create turnkey co-marketing, direct-to-MD messaging, direct-to-patient messaging, sales collateral. Companies are deploying these tactics, creating massive leverage for their team in the market. But you may feel like you should just keep doing things the way you always have. Or you may realize it's time to evolve. Learn more about heuristic-based neuromarketing and see medical device case studies. Visit trackablemed.com. Trackable Med. Leave nothing to chance.